Okay, so the atrial fibrillation is, what is atrial fibrillation? Before we go into ECG, I'll just tell you. Okay, so normally the atria is contracting, right? Atrial depolarization, ventricular depolarization, atrial depolarization, ventricular depolarization, right? Properly, right? But in atrial fibrillation, what's happened? The atrium is shaking.
Yeah.
Okay, the atrium is shaking, and it's not able to contract as a single unit. Okay,
Yeah.
instead of contracting, again contracting, it's like shaking instead of actually contracting. Does that make sense?
Yep.
Okay, so instead of, so it's fibrillating is kind of is similar to shaking, right? Instead of doing a proper contraction to push the blood to the ventricle, it's only shaking. So if it's shaking and it's not being able to push the blood into the ventricle, then the cardiac output will be low, right? Because
Yeah.
ventricle is not getting enough blood,
Hmm.
right? So that is the problem with atrial fibrillation, right? And then if the atrial fibrillation, if the atria is not able to contract properly, it's like only shaking, right? Then the blood is going to pool around in the atrium, right? It's
Yeah.
going to collect in the atrium because ও তো নিচে যাইতে পারতেছে না, কন্ট্যাক্ট করতেছে না. So there is a risk here. The risk here is if the blood is only, being accumulated in the atrium, then the blood, if it's not flowing, then there is a risk that it's going to be coagulated, right?
Yeah.
এমনি টেস্ট টিউবে ব্লাড যদি ফ্লো না থাকে তো লাইক ক্লট হবে না. So there is
Yep.
a risk of blood clot forming within the atrium, right? And then if the clot somehow dislodges into the ventricle, right? And then ventricle থেকে if somehow goes out into the brain, then there is a risk of what? Stroke, right? So the
Yeah.
major risk, the major danger of atrial fibrillation is stroke. Does that make sense?
Yeah.
Right. So can you tell me how does atrial fibrillation cause stroke in a patient?
Yeah. So it's like a thrombus, right?
Hmm.
Not thrombus, embolus actually.
Embolus.
It's like
Very
a
good.
embolus. Embolus goes out of the heart and blocks the cerebral artery, and there is hypoperfusion of the cerebral. There is a hypoperfusion in the
Brain.
brain.
Huh.
So that is stroke.
So why does the thrombus form or embolus
Because
form?
of the there is coagulation of blood in the atrium due to atrial
Due to
fibrillation,
atrial
sorry.
fibrillation. Why there is clot forming in the atrium?
Because atria is not able to contract in a single unit, it's shaking, it's fibrillating there. So that's why the blood is accumulating in the atrium, which will form the clot, and it goes into the ventricle, then to the cerebral
Great,
arteries.
right? Very good. Okay, does that make sense?
Yep.
Right? You can imagine what's happening, right? Now, why is this atrial fibrillation happening? Okay, the atrial fibrillation is happening because there is lack of command. Okay, usually in atria, the starting of this the electrical signal is only happening from the SA node, right? SA node is the single commander, right? It's saying it is always in command. It will say now start, after 1 second again now give signal, right? So that's why the whole of atria is following a single commander SA node, right? Single source of electrical impulse. Now in atrial fibrillation there are multiple sources of electrical impulse. Look at these. এখান থেকেও সিগন্যাল আসতেছে, এখান থেকেও আসতেছে, এখান থেকে. So instead of a single SA node, right, that is determining the contraction of the atria, now you get multiple sources of electrical signal, multiple SA node. It's not, we don't say it, but just to make you understand, there are multiple SA nodes, small electrical signals, right? So
How
ekta
does the
signal
electrical signals
signal
form? Like,
happen. Okay, now this can happen due to many causes. Like we'll come down to the causes of atrial fibrillation, right? For example, it can happen after a heart attack. If a person has a myocardial infarction, then that can also lead to atrial fibrillation. Why? Because see, so normally in a healthy heart the SA node is the only one is giving signals, right? But if a heart has damage by any cause, maybe it was a MI like 3 years back and a part of the atrium also got damaged, necrose, right? So any necrose tissue in heart, in cardiology, if a tissue is necrose, then it will have abnormal electrical activity. So maybe the person had heart attack 1 year back, 3 years back, so a part of the atria, right, or parts of the atria were necrose or ischemic, right? Now these atria will start producing abnormal, this damaged tissue will start producing abnormal electrical activity. Does that make sense? right?
Hmm.
Another reason is if the atria is too stretched. Now, normal atria is like this much size, okay? But for
Hmm.
example, if you have a mitral stenosis, right, normally blood goes like this, right? But if you have a stenosis here, right, there
Hmm.
is a blockage here, right?
Hmm.
uh, there's a better color, okay. If there is a stenosis here, then the blood pressure in the atria will rise, right? Because the blood,
Hmm.
there is a stenosis, so in the atria contract it cannot go, so the blood will just keep on stretching the atria, so the atrial
Hmm.
size becomes larger, then also the fibers in the atria will be stretched, no?
Hmm.
Right, so these stretched, overtly stretched fibers will also start producing abnormal electrical activity. Okay, so the
Hmm.
bottom line is if the cardiac tissue is abnormal, stretched or damaged due to any cause, then these
Hmm.
will start producing abnormal electrical activity. Does that make
Hmm.
sense? So,
Yeah.
so when you understand it like that, then you can remember the causes of atrial fibrillation. Okay, now, so now in atrial fibrillation, I told you the pathophysiology, right? What is actually happening? Okay, so so before we look at the ECG, okay, I told you a complication. What is happening? Why is atrial fibrillation happening? What is atrial fibrillation? Where are these currents coming from? Okay, just so I have
Hmm.
a good understanding. And then I told you a very important complication. What is the
Hmm.
most important complication of atrial fibrillation? Guess.
Myocardial infarction.
I mean, not complication. Man, atrial fibrillation হওয়ার পর কি
Oh,
হইতে পারে?
stroke.
Very good, right? And you can tell why the stroke might happen. Okay, so we have
Hmm.
very good concepts now. Okay, now let's look at what will be seen in an ECG. Okay, so now
Hmm.
when normally when there was a single source of signal, right?
Hmm.
SA node. Normally,
Hmm.
if there was a single source of signal SA node, then the heart rate would be regular, and there would be a like SA node at rate tha, right, 70 to 80 beats per minute, right? So there will be a normal heart rate, right?
Hmm.
Now there are so many signals, right? There's like crazy electrical activity, so the heart rate will also be crazy. Heart rate will
Hmm.
increase
Increase.
because there is not a single source. Now there are multiple sources and they're just happening all the time. There is no
Hmm.
gap in between.
Hmm.
Previously SA node and then ventricle contact, and then there was a gap, right? And again the SA node will contact, give
Hmm.
signal. Now there are so many sources of electrical impulse, there is no gap, everyone is firing at their own rate, so the heart
Hmm.
rate will be high, say
Hmm.
say 150, 200, right, 130, heart rate will be something like this. Okay,
Hmm.
so the heart, so in atrial fibrillation, usually you will get a high heart rate because of electrical activity going crazy. Okay, another thing is, see, when the SA node was producing signal, every time the SA node produced the signal would go to the ventricle, right?
Hmm.
SA node, AB node, ventricle, SA node,
Hmm.
AB node, ventricle, right? So one
Hmm.
SA node contact signal equals to one heartbeat. Can we say that?
Yeah.
Right, when it was normal, right? But now
Hmm.
there are so many signals, right, SA nodes in
Hmm.
the heart, but each of
Hmm.
them are very small,
Hmm.
right? So they produce such small signals that only, let's say, 10% of them are large enough to go into the ventricle, right?
Hmm.
90% of them, they are too small to go into the ventricle, right? In
Hmm.
case of SA node, every single signal was strong enough to go into ventricle, so one SA node contracts signal, one heartbeat. But in case of this, there are multiple small sources of signal, right? So one
Hmm.
signal, these only like 10% of them are strong enough to go, so all the 90% of the signals or the electrical contraction, they are not strong enough to go into the ventricle. So so if for like every say five signals, there might be one heartbeat. Does that make sense?
Hmm.
Do you have any confusion?
No. I
Right, so
mean, a little bit.
okay, yes, so I know I know it's kind of difficult to understand. So usually what I'm saying is, because each of these signals is very small, right?
Hmm.
Only one or two, after in, they say, for example, there were five signals produced, okay?
Hmm. Hmm.
So five of these electrical impulses were, because there's crazy electrical impulses, right? So this impulse, this impulse, this impulse, this impulse, there are five impulses produced, okay, in
Hmm.
1 second, okay, or
Hmm.
in 2 seconds. Only
Hmm.
this one was strong enough to go here,
Hmm. Hmm.
right? So
Hmm.
I'm saying is, in this case, one signal equals to
Hmm.
one heartbeat, because every
Hmm.
time this one is strong enough. But here five signals may only result in one heart rate. It might be
Hmm.
10 signals, out of 10 signals only one will actually cause a ventricular contraction.
Hmm.
Okay, okay, so why
Hmm.
am I telling you this? I'm telling you this because previously one signal, one atrial contraction, one ventricular contraction, so one P wave, one R wave, one P wave, one R, and it was regular. Okay, but in this case, right, the R waves or the R waves is ventricular contraction. Ventricular contractions are, they are not regular, because see, right now there was one signal that caused the one signal was large enough to cause a contraction, but for not the next 2 seconds there might not be any signal that was large, that is large enough to cause contraction. Okay, so so are you getting my point?
Yeah.
So so in this case, every single signal was causing a R wave, R wave, R wave, R wave, right? In regular fashion. But here, see, in this time there was a R wave. But for the next two seconds there was no signal. There were signals happening crazy like crazy, but none of them were strong enough to cause a contraction. So there was no R wave, right? But suddenly there was one that was strong enough. That is, this is a random process. You can never tell which signal will be strong enough to cause a contraction. It's a random process. Okay, so suddenly there was a signal that one of these signals was strong enough to cause a heart contraction, ventricular contraction. Okay, then after like say 1 second, okay, another signal came, right, that was strong enough. So there is another R wave. But now after that, so for next 3 seconds no signal came that was strong enough to cause a contraction. So there will be a gap of 3 seconds. So there was a gap of 2 seconds, 1 second, 3 seconds. So are the R waves coming at the similar interval, or they are variable gaps?
Variable.
Right. So if the R wave are variable, is the rhythm regular or irregular?
Irregular.
Irregular. Very good. So in atrial fibrillation, the rhythm will be always what?
Irregular.
Irregular. Why is it irregular?
Because there is so many electrical impulses. Maybe one
Yes.
of them will cause the ventricular contraction,
Yes.
maybe not. That's why
Yeah.
it's variable.
Yeah, because it's random. It's not predictable,
Yeah.
right? Any one of them can cause a contraction, and next for the next 5 seconds, no, none of them might cause. So it's random. So it's random. Since it is random, which one will cause a contraction? The contractions will be in irregular fashion. Make
Yeah.
sense?
Yep.
Right? All of this should make sense. Okay. Now another thing is, see, right? Now another thing is this. Okay, now previously I told you when there was a single SA node, the whole atria used to contract as a single unit, right? Right.
Yeah.
Now, but in atrial fibrillation there are multiple sources of signal, right? So the atria is shaking, right? So since the atrium is shaking, is it contracting as a single unit? No, right?
No.
It's just shaking. It's just shaking. So if it's shaking, then is it producing enough? If it's contracted as a single unit, you will get a nice P wave, like a pop, like that, right? Because it contracted as a single unit. But right now it's not even contracting; it's just shaking, right? So will you get a P wave? Right? Will Will you get a P wave?
No.
Not really, right? Because it's not actually contracting properly, it's just shaking, right? Right, in a normal heart rate, in a normal heart, you will get a good contraction, so you will get a good P wave. Here there is no contraction, it's just shaking, so you will get no P wave. Okay. So in a atrial fibrillation ECG, what are the findings you might be expecting? Okay, what?
The
Yes.
rhythm, there is no P wave,
No P wave.
and there is the ventricular depolarization is irregular.
Very good. So
That
the
means the
rhythm,
QRS complex is irregular.
right? That means you are completely. This means the rhythm is irregular.
Yeah.
Irregular. Right? So you can now explain. If someone asks you, okay, which no one will ask you, you just have to tell it like in exam, like you memorize it. But if someone asks you, why is the rhythm irregular? Can you tell, right? You can give a nice story like this, right? And if there's someone asks, why is the P wave irregular? Then you can say, why is it irregular? No, why there is no P wave?
Because there is atrial fibrillation, so there is no proper atrial depolarization, and it's
Yes.
not contracting in a single unit
Unit,
as a
right?
single unit. So that's
That's why
why
there is
there
no
is no
P wave.
PV. Yeah.
Mashallah, very nice, right? So now you know everything about atrial fibrillation, fibrillation, okay?
Yeah.
So let us just look at the ECG just to confirm whatever we have studied is actually true or not, okay? Because I might
Yep.
be lying to you as well. So let me see. So let's look at this ECG, atrial fibrillation, right? Now
Yeah.
first thing I told you, the first thing is always, how do you describe an ECG? First thing is the rhythm,
There's a
then the rate.
two. Oh,
and
yeah.
then you'll look at if there is any abnormality of the shape of the ECG. That is the
Yeah.
pattern, right? So let's describe this ECG. Okay, first thing, you'll look at the rhythm from what? The strip at the bottom, that is the longest one,
Hmm.
right? Because it's
Yeah.
the longest one, so it's easy to read. So let's look,
Hmm.
whenever you get a ECG, your eye should always go to the one at the bottom, the longest
Hmm.
one. Okay,
Hmm.
so in this case I've already annotated so that's easy to check. Okay, so
Yeah.
this is the actual ECG from your prof, which will
Hmm.
give, okay, a long time after this, but see, this is the actual ECG that they'll ask you in prof. Okay, I just took a picture
Hmm.
and then I annotated this.
Hmm.
So look at this.
Hmm.
So in lead 2, the longest strip, let's look at this. Let's look at the rhythm first. Okay, is the rhythm
Hmm.
regular or irregular? What do you think?
Irregular.
Right? Why? Because let's look at this.
The R waves are not in the
Right?
same
So this
position.
R, yeah, this R wave is very short, right? But
Hmm.
this R wave, these R waves are very long,
Hmm.
right? So the rhythm is obviously
Hmm. Irregular.
right. Now let's look at whether we can find a P wave or not. Okay, is there a P wave? Can you see a P wave?
Hmm. No, not
I mean, look
really.
at, yeah, look at this. Okay, it's
Hmm.
like this,
Hmm.
like this, and like this. Okay, let me draw
Hmm.
this with a smaller pen. Alright, it's like this, and
Hmm.
like this. There is
Hmm.
QRS and P
Hmm.
wave. There is no
Hmm.
P wave. See, it's flat in front of
Hmm.
it. Right, look at this. There is no P wave. It's flat, and then you
Hmm.
get the QRX compass and T wave.
Hmm.
Right, right.
Hmm.
Look at this again. It's so hold on. Okay, it's kind of inverting right now because most is okay. Look at this again. Flat, QRX, and then T wave. So is there any P wave here?
No.
Right, there is
Hmm.
no P wave. It should be something like this, but you can't see it, right? So there is
Hmm.
absence of what?
P wave.
P wave is what? Absent,
Absent.
right?
Hmm.
Now calculate the rhythm. Okay, I'll probably hide the rhythm. Okay, I'll just let you calculate the rhythm. Okay, just an
Rhythm.
exercise. Not rhythm.
Uh,
Rhythm is irregular. Okay, calculate what?
uh,
Heart rate. Calculate the
rate.
rate. Okay, from this strip.
The three. That means 300 divided by 3. That means 100.
Okay, pause. That could you do? You could do when the rhythm
Oh,
was
sorry. Sorry. That is regular.
regular, right?
Yeah.
You're right,
Wait.
but it's not regular. It's irregular. So how will you calculate
Irregular.
the heart rate now?
The 30 boxes.
Okay, so that's going to be a really that's going to be a lot of pain calculating this. But let's approximate. So I'm just giving
See,
you
I was
approximate.
right.
What?
100 beats per minute. You wrote it.
For example, this is 100, 30 boxes. I don't have time to calculate 30 boxes.
Hmm.
Okay, so how
Hmm.
many R waves are here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10,
9,
11, 12,
10,
13, 14.
12, 14. Hmm.
Okay, probably I counted more than 30 boxes. So if it's 14 times, how much?
10,
10,
140.
right? So it will be 140. Okay,
140.
beats per minute. Okay, apparently this, so then this much must be 30 boxes. Okay, that's how I calculated
Yeah.
100 beats. Okay, makes sense. Okay,
Hmm.
so in your exams, what are you gonna say? This is 12 lead ECG, blah blah. 12 lead ECG showing the rhythm is irregular.
Irregular.
The heart rate is approximately
Hmm.
100 beats per minute. Okay,
Hmm.
ठीक है से?
Yeah.
And it shows there is absent P wave.
Hmm.
Absent P wave. So irregular rhythm and absent P wave. What is the combination? So hence my impression is atrial fibrillation.
Fibrillation.
Right,
Fibrillation.
fibrillation.
Hmm.
Okay, it's fibrillation. Does that
Hmm.
make sense?
Yeah.
Right, so next
Hmm.
time you see an ECG like this, okay, you're in the ward, you see an ECG, and in
Hmm.
the diagnosis paper they have written
Hmm.
atrial fibrillation, right?
Hmm.
Like ischemic heart disease with atrial fibrillation. তো তুমি কি করবা? এক্সরে ইসিজি দেখবা আর নিজে নিজে বের করবা যে এটা
Hmm.
ইরেগুলার আছে কিনা, পি ওয়েভ অ্যাবসেন্ট কিনা, right? So can you just
Hmm.
identify it, right?
Yeah.
So that is all. So right now are you confident তুমি atrial
Yeah.
fibrillation এর ইসিজিটা পড়তে পারবে, right?